So the nursing process is something that we use in all of nursing, including administering medications. The old nursing process is assessment, diagnosis, plan, intervene, and evaluate. We are beginning to start to call that nursing diagnosis section analysis, but the decision on that is still up in the air. The American Nurses Association has shifted to the word analysis rather than nursing diagnosis. So we used to say add pie, now we say always apple pie. So assessment, analysis, plan, intervene, and evaluate. Assessment can be head to toe or it can be focused. Oftentimes when we're giving meds, like say insulin, it is a focused assessment. Our assessments determine if there is an issue. The nursing diagnosis tells us, okay, what's actually going on? And that's also what the new analysis wants us to think about, is what's actually going on? What do we need to target as our thing that we need to help the patient improve here? It can be actual or potential. So it can be like a patient, an actual thing would be an actual fall. And a potential would be a risk for a fall. Related to the etiology is the reason why they had a fall or are at risk for having a fall. And then the symptoms are the evidence. The AEB is as evidenced by, and it's oftentimes the symptoms or what you can see as evidenced by patient on floor with bruising. Potential risks don't have those symptoms to evidence them by. Etiology is the cause, set of causes, or a manner of causation of a disease or condition. Some of the old school nurses won't let you use medical diagnoses for etiology, and some of the newer ones will. So just kind of get your feeling out there for where your instructor is at as far as that's concerned. In your plan, you should have objectives, which are broad, and goals, which are a little bit more specific. Your goals are going to be SMART goals, and they'll start with the words, the patient will. SMART goals should be specific, measurable, attainable, reliable, and timed. We intervene. Our intervention should start with the intervention statement, should start with the nurse will. Those are also SMART. When we evaluate, we look at the outcomes. Did we meet the patient's goal? Is the patient okay? I gave insulin, so I'm going to evaluate all day. I'm going to be watching that patient, evaluating if their level of consciousness changes or if they get a headache and are sweaty and confused. My evaluation may be telling me, okay, I need to start the nursing process over and go assess them and go get a blood sugar. We can use outcomes in a broader scale to look at evidence-based practice. And that's all.